Mr. President.
The Republican leader.
Mr. President, our good friends on the other side of the aisle have spent 6 weeks behind closed doors putting together this trillion-dollar experiment in government-run health care that raises premiums, raises taxes, and makes drastic cuts to Medicare. We've now had less than 48 hours to look through this 2,074-page bill. But there are 10 things that we know for sure that every American should begin to understand. There are 10 things about this bill that we can begin to convey to the American people with certainty starting this morning. The Democratic bill includes nearly $500 billion in new taxes that hit virtually every single American, including, Mr. President, most importantly, including middle-class families who make less than $250,000 a year. Almost $500 billion in new taxes, a substantial part of it hitting middle-class families who make under $250,000 a year. The second thing we know about this massive 2,074-page bill is that it will raise insurance premiums for the 85% of Americans who already have health insurance in our country. So we know buried in this 2,074-page bill are higher insurance premiums for all Americans. Mr. President, the third thing we know about this massive 2,074-page bill is there will be huge cuts in Medicare, $500 billion in cuts in Medicare over 10 years. And it will limit many of the choices that seniors now have. Additionally, Mr. President, this monstrous 2,074-page bill, according to the Congressional Budget Office, will not lower health care costs. And my recollection was that the principal reason we went down this path in the first place was to do something about the cost increases that are hitting American businesses and individuals. So we go through passing, presumably, I hope we don't, but if we pass this 2,074-page bill, we will actually increase costs. The true cost of this bill, which was not stated by the majority at the announcement of the bill, if you look at the 10-year period when everything is implemented, the true cost of the bill is $2.5 trillion. Certain gimmicks were employed to try to make it look like it actually was deficit neutral or even raised money for the government over 10 years. And the way that was done, Mr. President, was to delay the implementation of parts of the bill. But once everything kicks in, if you look at a 10-year window after everything kicks in, this monstrous 2,074-page bill would actually cost $2.5 trillion. A massive, massive expansion of the federal government. The sixth thing, Mr. President, we know about this bill, for sure, is if you like the health insurance you have, you may not be able to keep it. Buried in this 2,074-page bill are provisions that clearly indicate that if you like the health insurance that you currently have, you may not be able to keep it. According to the Congressional Budget Office, the Democratic bill would force millions of Americans off of the health insurance they currently have. Now, Mr. President, the seventh thing we know about this bill is that it would let government bureaucrats dictate what kind of health plans Americans can buy. No longer would they have the option to buy whatever health care plan might make sense for their family. The government will prescribe what kind of insurance plans Americans can buy, and thereby, of course, what benefits they can receive. So some bureaucrat here in Washington is going to dictate the plans that are available for the American people. I suspect that people who are young and healthy and have got high deductibles may not have that option anymore. Those are the kind of Americans, Mr. President, for whom the cost of insurance is going to go dramatically up. What else do we know about this 2,074-page bill? It creates a government plan that the Congressional Budget Office has said would bring about higher premiums. Now, we have said that the whole point of the government plan, the majority has said the whole point of the government plan, having the government in effect get into the insurance business, is to offer a lower cost alternative. But the only way to do that is to subsidize costs, ration care, and undercut private insurers, which could lead to a government takeover of health care. So the Democratic plan, Congressional Budget Office, actually says that the government insurance plan, the government insurance company, would have higher premiums. So clearly the only way it could have a positive impact on the cost of insurance would be to subsidize costs, ration care, and undercut private insurers. And of course that, Mr. President, would be the first step toward what some of the more candid liberals in the House have said is a single-payer system. They're actually disappointed that this bill doesn't go far enough to create a government insurance company which then leads to a single-payer European-type system. What else do we know about this bill, Mr. President? Well, the Democratic bill, for the first time in history, would allow federal programs to pay for elective abortions. How do people out in America who feel strongly about that issue, what do they say about it? Well, according to an AP story just this morning, a direct quote from the person with the Catholic bishops who works with this legislative issue here on the Hill, here's what he had to say. And this is a quote from this individual who works for the Catholic bishops on legislative issues. Here's what he had to say. "This is the worst bill we've seen so far on the life issue," end quote. Spokesman for the Catholic bishops on what is buried in this 2,074-page bill on the issue of whether the government will for the first time allow federal programs to pay for elective abortions. Another observation he made about it, and this is a direct quote, 2 words, spokesman for the Catholic bishops, completely unacceptable. Completely unacceptable. The abortion language in this 2,074-page bill, Mr. President. That's how the Catholic bishops apparently feel about this. Finally, Americans should know that this bill doesn't have the common sense reforms that they've been asking for all along. Nothing in this massive bill about getting rid of junk lawsuits against doctors and hospitals that CBO said cost us $54 billion over a period of time. Nothing in the bill about leveling the playing field when it comes to health care taxes. Mr. President, what the American people would like for us to do is to step by step address the cost issue to them. This bill doesn't do that in any way. Americans would like to have health care reform, but higher premiums, higher taxes, and cuts to Medicare to produce more government isn't reform. Yet that's precisely what we would get were we to pass this 2,074-page bill sitting here beside my desk. Mr. President, I yield the floor.
Under the previous order,